Welcome back, folks. This is Dan Solloway, the host of the Health and Fitness Radio Show, and you're listening to News Talk 1520 KOKC. I have Dr. Pai with me, and he's a medical doctor out of New Mexico, and he has an interesting background, and we're going to be talking about a very important health-enhancing ingredient called CBD. And this is all over the news, but there had been some problems. Now there's not a problem when you take it just in the form of CBD. And I'll explain to you what I mean by that. It's a little confusing right now. Now, Dr. Pai, thank you for being with us.
Thank you.
Now, give us some background. What medical group? What's your background as a doctor?
So I'm conventionally trained in family medicine here through the University of New Mexico. I'm also currently a adjunct faculty member here at the Department of Family Medicine. But after I finished my residency in family medicine, I was one of the first physicians in the United States to get formally trained in integrative medicine with Dr. Andrew Wall at the University of Arizona about 14 years ago. I then afterwards studied with Deepak Chopra, and then I went to India, studied Ayurvedic medicine, came back. I studied my acupuncture training through Stanford. I did my nutrition through Cornell. We publish in medical journals, and we assist with clinical trials and also lecture around the country on the use of natural therapies in preventing and treating most chronic diseases.
Well, that's a really impressive background. And speaking of natural therapies, I want to talk about the CBD, which is an ingredient found in hemp. And without the THC, that I guess they have genetically engineered, from what I understand, someone spent about $70 million genetically engineering the hemp seed to make it high in the CBD ingredient that has so many health benefits for the people, and have down leveled the amount of THC in it, so people don't have the trouble with getting high that came from marijuana. And but they do get all the health benefits. In fact, it would help someone that had problems with that to straighten out their thinking, basically. It would sober them up. But CBD, tell me what you've done in the way of research in that area, what you've seen.
So what we've seen is now in the last few years is an explosion in the literature. Just on medical cannabis, there was about 12,000 publications, but in the last 5 years, there's been an explosion in the area of research on CBDs or cannabidiols. And there's about 1,200 now publications in the last 5 years showing the variety of health benefits of CBD. Now, CBD comes from the hemp plant, which is in the same species or family, again, as cannabis, but it does not have the THC or the psychogenic component or the part that makes people high. And what the research is showing is that with the CBDs, we can have studies that will show that it'll decrease pain, being an analgesic or an anti-inflammatory. It can actually help reduce a little bit of blood sugar, so there's a little bit of a role with diabetes. It helps with reducing seizures, and you'll probably see in a lot of documentary films on the web and on CNN that these children that have these severe seizure disorders, and this is something that can be drastically life-saving for them. Mm-hmm. It also has been, aside of the reducing inflammation, it also has been able to be showing improvements in people's insomnia, so it aids for people's sleep. It also, in cancer patients, it's been shown to inhibit cell growth in tumors, not only in the beginning stages, but throughout the stages of the different cancers to the metastasis of cancer. So that's kind of a full range of that. It's been shown to treat psoriasis. It's been shown to treat and manage psychosis symptoms, so like antipsychotic behaviors. Also helps suppress muscle spasms. So when we see people with MS that have spastic rigidity, it's been very helpful for those kind of patients. For most of my patients, and just general in myself, there's a kind of a relaxation effect where it can help people just having just general anxiety. Most of us at the end of the day are stressed out, and for example, myself, I take about 3 milligrams at bedtime sublingually, and it helps me sleep like a baby. But I don't wake up with any kind of hangover effect. It's not a melatonin. It doesn't make me sleepy. But it just has that, it helps focus and relax my body. And for most of my patients, that's what they're getting the benefits just for a common use. There's data that shows that it promotes bone growth, so this helps with osteoporosis issues and supporting immune system functioning. And more importantly, it's been shown to protective nervous system degeneration, which means Parkinson's disease, traumatic brain injuries. Now we've even been shown that studies that after there's been a brain injury, we can give the cannabidiols, and that will help actually regenerate kind of the brain. The brain is something we call neuroplastic. It can actually regrow. We used to think these things were just static. Once it was damaged, it was done. And now we actually have something that can actually help prevent the onset of worsening and also help reverse some of those damages that may have occurred from a traumatic injury or just through aging.
Interesting. Now, one of the things we said in another interview I did with you, and it helps with autoimmune diseases in general, wouldn't it? Because it brings down the inflammatory cytokines and interleukin 6. And so it would help balance or bring into homeostasis the immune system. Am I correct in that?
Absolutely. And with most people, the interesting thing about cannabidiols is it affects different receptors. And so a lot of people just think of cannabidiols or CBD receptors being in the brain, but now the research shows that there's two types of receptors, a CB1 and a CB2. Some of them are in the brain, but some of them are in the rest of the body tissues. And we've found these receptors not only in the brain, but we've found it in the bone. We've found it in our organs, our glands, our connective tissues, and our muscles. And therefore, there's a variety of benefits, because what we're finding out is that the CBDs create a homeostasis response, meaning that in certain areas there might be a hyper response where, say, someone's immune system with an autoimmune disease is overactive, so the body's kind of aggressively attacking itself. Where in other people, they might have a hypo-functioning where it's not strong enough. And the nice thing about the CBD is it does create this balancing effect. So it's not just a minus or a plus, it's a minus or a plus where that plus or minus needs to be added to the body.
Well, there's another thing in nature that does that called proline-rich polypeptides, and I wonder if it interacts with the same receptor sites or they work together. I know it works in a very similar way as far as regulating the immune system when it's underactive or overactive, bringing it back. But now, there's different qualities of CBD out there, and I know a lot of people are going to hear this and they're going to go on the internet and they're going to start looking for it, and finding the right form is essential, I believe, like it is in almost anything else when we're talking about something being therapeutic or not being therapeutic or being healthy or toxic, one or the other. Am I correct on that there's different forms of CBD being sold out there?
Absolutely. And, CBD is completely legal, and since it comes from hemp oil. And so when it comes from hemp oil, it's legal in all 50 states, and it's considered almost like a dietary supplement or a food that we consume. It has traces amounts of THC, so no one can get high from it. But the problem is, since it's also a dietary supplement, there's a variety of sources that people can get the hemp oil from. And over the last 2 years, we've seen some problems in the marketplace of people bringing hemp oil cheaply coming in from China, and there were some issues with bacterial content or microbial content in the batches, as well as they're not necessarily standardized for a potency to say how many milligrams of CBD per dose or per delivery system.
Now, Dr. Pye, hold on. I need to go to break, and I'll be right back with you in just a moment. We'll be right back, folks.